Thank you all for joining us today for the launch of a new research policy briefing from the Centre for Care. For those of you not familiar with the Centre for Care, we're a research centre funded by the Economic and Social Research Council and the National Institute for Health and Care Research. We've been around since 2021, and one of the core areas of our work is on care workforce change. And we have a research group led by Shireen Hussain from the London School of Hygiene and Tropical Medicine. And this piece of work comes out of some research that Professor Liam Foster and Dr. Duncan Fisher have been doing around care workforce organising. So this particular research briefing is called Successfully Engaging Paid Care Workers in Organising Challenges, Opportunities and What Works. And next slide, please. So I'm really delighted to welcome both Duncan and Liam to present their briefing, but also we've got some fabulous speakers lined up to kind of provide a response. So in terms of the structure, we're going to have 15 minutes from Liam and Duncan to give an overview of that briefing, which will be available at the end of the session, and we'll put a link in the chat. And then we're going to have three brief responses from three invited guests. So we have Amaka Moluku, who's a paid care worker and a member of Home Care Voices, the Home Care Voices Advisory Board and the Care Worker Charity Advisory Board, and is a part of the Care Worker Champion project there. We're delighted to see Amaka. We've also got Kevin Lucas, who's the head of National Strategic Organising Unit at Unison, which is a trade union. And Kevin is leading on their Organising to Win strategy, which has a particular focus on social care. And last and by no means least, we have Lydia Hayes, who is a professor of labour rights at Liverpool University and has a fabulous award-winning book called Stories of Care, a Labour of Law. And she is a principal convener of the AHRC Centre for People's Justice. So delighted to have everyone here today. I think without further ado, I can hand over now to Liam and Duncan.
Thanks, Kate. Much appreciated. All very clear. As Kate said, the purpose is essentially to launch the policy brief based on the work we've been doing and get some responses and feedback in relation to that. You'll find that there's more information on that brief than of course we can talk about in today's session, and that will be launched later in the session. And of course, if people had opted to be sent that as well when they signed up, people will also be emailed about that as well, and we welcome people sharing it as widely as possible with people who think it may be useful. I also just wanted to quickly mention, I mentioned to someone already, I had dental surgery yesterday afternoon, so if I'm garbling and less coherent even than usual, that's my excuse today. But other people will be doing more speaking than me anyway. I just wanted to briefly take you through what we'll be covering. I'm going to be talking about the first three parts of the session that Duncan and I will be doing. So I'm going to provide a short introduction to the context of organising of paid adult social care workers in England specifically. Then going to move on to relevant features of adult social care employment and the workforce in England before outlining the research study and what we've done. We'll then focus on key barriers to paid care worker involvement in organising and union activity, where Duncan will be talking about that, before moving on to contributors to success in engagement and sustaining paid care workers' involvement in organising and union activity, before finally we'll present the recommendations for engaging paid care workers in organising. Next slide, please. So I think there are some things that it's important to note in relation to organising. So for instance, paid adult social care workers lack the protections of widespread union membership and collective bargaining coverage. An estimate suggests 15% of privately employed adult social care workers are unionised, compared with 21% in the wider labour market. And of course, if you were to look at the NHS union membership, that's far higher as well. There is a lack of recognised sector-wide professional body to represent the particular interests of paid care workers in adult social care. And I also think it's fair to say that interests of these workers are hampered by adult social care's more general lack of political traction. And hopefully that will change going forward. Um, it's also important to note that despite low membership, unions are doing a range of activities, some of which have been extremely successful, as we'll hear about later. Next slide, please. So moving on to consider working conditions and their impact, and why we think that adult social care workers are such an important group to consider. Well, conditions remain poor, amongst the worst in the labour market, so things like low pay, contractual insecurity, worker poverty, exploitation of migrant workers, and underdeveloped career structure, so limited promotion opportunities, for instance. There are continued sector level problems with sustainability, including high levels of staff turnover, which of course is linked to these challenging conditions more generally. These conditions also disproportionately impact certain groups. I'm not going to go into lots of detail here, but particularly in relation to women who are often involved in these caring responsibilities and roles, both paid and unpaid, and also minority ethnic groups. And I think it's also worth noting that the workforce in England is particularly poorly treated. For instance, counterparts in England and Wales are guaranteed a real living wage. Next slide, please. So, having provided a little bit of context, you can read more about that in the report and in other papers we've written. I want to outline a little bit about the study and what we actually did. So it investigated examples of organising and union activity amongst paid adult social care workers and those representing their interests in England. So in total, we had 41 participants interviewed across different organisations. So established and independent trade unions, community organisations, and campaign groups. And these took place between December 23 and March 25. There were two particular groups of participants. We had what we called key actors, so organisers, administrators, or founders of organisations. And these interviews focused on things like organisational level issues, including priorities around organising, resources and access, as well as considering some of the kind of barriers and successes in relation to organising. We also interviewed a number of paid care workers who were involved in organising, and it's a pleasure to see a number of those here today in the audience as well, who obviously provided frontline detail on individuals' motivations and attitudes towards organising. And this included examining both barriers and factors that have encouraged engagement in organising. It's worth noting that adult social care workers not involved in organising weren't included in the sample, but I think it's also fair to say that the interviews with the paid care workers and key actors really got at why people didn't want to be involved, and sometimes around lack of awareness as well of opportunities. Okay, so you'll see there's various different organizational groups involved, community organizations and campaign groups. Next slide, please. So don't want to go into a lot of detail here because Duncan's bits are far more interesting than mine. But this table provides a bit of a breakdown of the types of organizations and numbers of participants in the different organizations. And it's worth noting that pseudonyms were used for individuals' names, but some organizations gave permission to be named. For others, those pseudonyms are employed for organizations. So that just gives you a little sense of the numbers of key actors and paid care workers involved in the study. I'll hand over to Duncan for the next slide, please.
Thank you very much, Liam. Yeah, so we identified 8 key barriers that are impeding paid care workers' involvement in organising and union activity. And this was based on our reading and on our analysis of the interviews that we did. So the first barrier is workforce fragmentation. This is in part due to outsourcing of services, with there now some 18,500 care providers across England. It's also due to the varied settings and spread of workers across people's own homes, communities, and residential settings. So this hinders collective action. The second barrier is pay and conditions. So the poor pay and conditions generate insecurity and they contribute to this high turnover. This has implications for continuity, which is so important to sustained organising. The third barrier is the nature of adult social care employment itself, which can be exhausting, can be demanding physically and emotionally, and it can be characterised by long and unsocial hours. 4 out of 5 frontline care workers are women who continue to perform the bulk of unpaid care work, limiting their time for other activities such as organising. Care work's lack of status and societal recognition can shape workers' own downplaying of what they do. Catherine, who was a key actor from an established union, offered this perspective. Probably one of the reasons why people don't join a union is they don't see themselves as professionals. They don't see themselves as important as a nurse, as you know, somebody that's been to university and all the rest of it. They just go, oh, I'm just a care worker. The fifth barrier is around access. Unions often lack access due to the scarcity of recognition agreements. We also found employer hostility to be a factor. Another barrier is lack of knowledge about organising among care workers. Many are not in spaces where such information is communicated. Adult social care is different from unions' traditional strongholds. The seventh barrier is fear of consequences where employers to discover workers' involvement in organising. This is heightened for migrant workers whose citizenship and residency status are often connected to their employment. The final barrier is union communications that exclude workers, including around bureaucracy, language, and digitalisation. Claude, a care worker and member of United Voices of the World, which is an independent union, shared this example of helping a colleague attempt to contact an established union. When I helped her with the form to get in touch with the established union, you have to go online, you have to call somebody, you have to fill a form. They give you like 14 pages of paperwork to do, and then you sit and you wait. They come to represent you. They're not engaged. Moving on from barriers, we found that there were actions that these organisations took that brought success in engaging care workers and in sustaining their involvement. We identified 5 such examples based on our interview analysis. The first contributor to success is knowing about care work and listening to the workers. Cynthia, a care worker and United Voices of the World member, voiced frustration at not being listened to by her employer. We go for meetings and we go asking about what's going to be much better for us, but they're not listening. They don't care. In contrast, collective workers key actor Catherine said unions ought to be willing to sit down in the workplaces or where the care workers are and listen to their concerns, understand their concerns and the challenges that they face and empathise with them. A second contributor to success is workers themselves playing leading roles in activities, including leadership. The choice of organising issues was crucial, namely their relevance to workers' everyday experiences. Doing issue-based campaigns that people care about is by far the most important thing, said David, who is a key actor in Work Together, one of the established unions. A third example is the effectiveness of varying communications and modes of contact. Media engagement has been important to the growth of organisations such as Home Care Voices. Providing accessible information in various languages is also important, given the disproportionate representation of migrant workers in care work. The fourth example follows on from the third. Providing different spaces for worker involvement was important in confronting fragmentation. Wendy, a key actor from Care and Support Workers Organised campaign group, emphasised the importance of online meetings. Some people appreciated having the space where you could come together and share your experiences. You realise the issues that you're experiencing aren't just individual to you. The last contributor is building networks and alliances, which had numerous positive functions, including building external support. This included financial support and awareness, and energising existing members. We end our presentation with 6 recommendations for organising seeking to engage paid care workers in organising. Again, these are based on our analysis of the interviews. The first recommendation is to listen to care workers in an engaged, sustained and meaningful way. For example, United Voices of the World's listening and deep engagement inspired and empowered worker organising. This contrasts with care workers' experiences of not being listened to by employers and their lack of wider visibility. Our second recommendation is to give care workers responsibility, platforms, and roles in decision-making and leadership. Care workers' voices have been sidelined for too long. Have them front and centre of messaging, and avoid repeating others' marginalising of care workers and their views. Thirdly, we recommend that organisations avoid creating barriers to care work involvement where possible, such as with cost, bureaucracy, language, and digital exclusion. Using accessible language in English and other languages, clear processes, and providing digital support when necessary can reduce barriers. Our fourth recommendation is to consider ways to bring care workers together. Bringing people together allowed workers to share experiences and offer solidarity, which they valued deeply. In-person meetups were especially meaningful, and these collective spaces were also where issues to act upon were identified. The fifth recommendation is to pay close attention to how care workers' involvement is framed and what you want them to do. We found scepticism around unions and organising, including a related sense of futility that things won't change. Educating and publicising successes are important ways to counter this. Our final recommendation is to be aware of complex pre-existing views on organising among care workers. We found that they had multifaceted views, including around care work's relational nature and the implications of organising for care services. Be aware of workers downplaying their role, but try to harness their sometimes latent desire for change. Thank you very much for your attention. Before I pass back to Kate and hear our 3 responses, Liam and I just wanted to say a few thank yous to people who have supported and contributed to the research, the briefing, and this event. Firstly, thank you very much to all those who participated in this research, the paid care workers and key actors from unions, campaign groups, and community organisations. It's great to see some of you here today, so thank you very much. Thank you also to today's speakers, Amaka, Kevin, and Lydia. We're delighted to have such an exciting panel. Thank you to our chair, Kate Hamblin. Your contribution is much appreciated. Thank you also to our colleagues within the operations team here at the Centre for Care, who we have worked with on preparing the briefing and organising this event. So Dan Williamson, Faye Benskin, Sarah Gibbons, and Kelly Davidge, thank you all very much. And finally, thank you all for attending. Thank you for your support and your interest. We are keen to connect with people and organisations, so please do contact us after the session for further information, or if there are ways that we can talk and discuss further if this might be useful in your own work. Here is some information about contacting the centre, and I will now pass back to Kate.
Thank you very much, Duncan and Liam. Really, really wonderful overview of a huge amount of work that's gone into the briefing. Thank you. So I'd now like to open up and bring in our respondents from a variety of different organisations. So first I'd like to ask Amaka if she would like to reflect on what she's heard. And just in case people have joined slightly late, Amaka is a paid care worker and is a member of the Home Care Voices Advisory Group and the Care Worker Charities Advisory Board, and is also part of the Care Worker Champion Project. So Amaka, if you could reflect for 5 minutes, I'll give you a little wave with my hand and then with my virtual hand at 4 minutes, just so you have a sense of where you are. But yes, I'd like to welcome you to add your comments.
All right, thank you very much. And it was a wonderful overview, like you said, of what a lot has gone into it. And I'm so happy to be a part of it. And I'm happy to be speaking as well. And she introduced me as a paid care worker. I'm also a migrant, so I'm on a healthcare visa. And he mentioned, some of the challenges we face. I'd like to just summarize it as fear, fragmentation, and fatigue. As I think these are the challenges, that we face, and they are under these 3 topics, because there's this fear of, as a migrant worker, if you organize, you'll be, threatened and reminded that you're on a visa, you can't really say much, you can't do much, you have to do certain things that even if you're not comfortable with. So that fear can prevent you from organizing, with your fellow colleagues, and we need to find a way out of it. So of course the sector is fragmented. We already know that, but that just means it can be redesigned. We can come together again. Part of why we organize is to come up with ideas, creative solutions to problems, but not just organizing to look for trouble or become troublemakers. We come up with ideas and we want to add value. We have wonderful insight, and it's awesome that everything has been captured. I really can't add much, to be honest, because everything has been captured and outlined beautifully. And I hope, the misconception of organizing is a myth now. We organize because we want to look for creative ways to report our employers. Again, that's not very true. And that can also prevent us from wanting to come together. So I mentioned fear, I mentioned fragmentation. I feel those are really, really threats, but it works. I'm here speaking. Yesterday I was at very posh House of Lords afternoon tea with the Care Workers Charity. That was awesome. That's a benefit of organizing and coming together, because it means our voices are going to be heard. It may be baby steps, but eventually I believe there'll be a change. And yeah, hopefully things would work out for good. But it's unfortunate that we're organizing because there's a problem, but I'm positive that there will be solutions as well. So it's lovely to be here. That means something is working, right? Something is definitely working. And I'm thankful for the Center for Care for looking into this. Yeah. Unison, I would like to talk about Unison, because part of why I joined Unison, I've known about Unison for a while. But when I saw the early day motion and the certificate of common sponsorship, that just moved me to register, because it showed they were paying attention, to some of the challenges. And well, you can argue that unions have the agenda, of course, but they paid attention. And social care membership, membership of the social care workforce surged during that period. That shows you they're doing something. Of course, we're still hoping for a positive outcome from that, but that's another evidence of coming together, to speak out and then see change. So that was part of why. That's my Unison story anyway. But the most rewarding part of my story so far has been serving on I'm a proud home care voice. Anywhere I go, home care voices is key, because we're doing something powerful, and I feel very privileged to be a part of it. And also the Care Workers Charity as well, giving us voices and taking us to places we normally would not have gone to, and again, that's a testament of what organizing can yield. So thank you.
Thank you very much, Amaka. Really, wonderful reflections on the 3 Fs of fear, fragmentation, and fatigue. And I don't know, I wonder if fatigue can be kind of reduced by meeting and re-energizing and kind of being inspired by others. So thank you so much for your reflections. I do welcome people to put questions in the chat, and we will be asking them after we've had all the contributions and all the feedback. But your reflections, Emeka, then bring us really nicely into inviting Kevin Lucas, who's the head of National Strategic Organising at Unison. So Kevin, do you want to add your reflections now, please?
Yeah, thank you. Thanks for the invitation, and thanks so much for early sight of the paper. And Emeka, thank you so much for that endorsement of Unison. It means a lot. So Unison we're the largest union of social care workers in the UK, with over 190,000 social care workers in membership. So we've got a real interest in this work and experience of organising in social care, both successful and unsuccessful. And the barriers outlined in the paper very much mirror Unison's experience of organising in social care. And for the last few years, we've been adapting the way we organise in response to those challenges. We've introduced a new role for social care members who want to help build their union, but without the full bureaucratic commitment to a formal activist role. That role comes with online trainings, which are short modules, timed to fit with shifts and carer responsibilities. And we've built regional networks, providing peer support and encouragement for active social care members, and it's going well. We launched the role earlier this year and already have over 2,000 social care workers participating in organising activities, the majority of whom are migrant workers, and social care has become Unison's fastest growing area of membership. And these changes and other recommendations outlined in the paper are vital foundations for successful organising. But I think the recommendation that isn't sufficiently emphasised is under point 5 that Duncan mentioned, to promote the success of organising and be aware of scepticism. I think, Duncan, you went further and talked about the futility that things won't change. And I think that is so important, because we know that care workers are time poor, are cash poor, and are often scared of employer retribution. And I think instinctively, many social care workers know that the starting point is they have very little collective industrial strength in their workplace. And let's think about that. Unison, as I say, has over 190,000 care worker members. That's exactly double the number of rail workers who are members of the RMT. Yet you don't find us shutting down cities by care workers anytime soon. Our industrial power is limited. So whilst it's vital for unions to deliver the recommendations in this paper and deal with the barriers, we also need to consider what will motivate social care workers to join unions in larger numbers. And in Unison's experience, and I think what is maybe missing from the paper, is the need for organising strategies around a credible plan to win a significant material change. And by credible, I mean credible to the worker. So they look at the plan and think, okay, this is worth my time, it's worth my money, and it's worth the risk because we can win this, and when we do it, will improve my life. To do this, unions need to move beyond vague generic promises of more members equals more bargaining powers, because care workers aren't daft. They know that in their workplace, it's not as easy as that. So a credible plan must allow care workers to identify what they want, identify the decision maker who can give it to them, and identify the levers we need to pull to make the decision maker agree to those demands. So usually a union organising campaign would target the employer as the primary decision maker, but in social care that's really hard because it puts precariously employed workers into direct conflict with often hostile employers, and that's not a rational position for any worker to put themselves into, particularly if, like Emeka, you're a migrant worker on a sponsored employer visa. So where we have had our most organising successes in social care is when we have taken our organising outside of the workplace. Because although care workers currently have little industrial power in the workplace, as community key workers with public sympathy and support, they can, if organised, hold significant power over their local elected politicians, who can in turn instruct the providers they commission to raise standards. And that makes for a plan to win that is credible to the worker, that doesn't place them into immediate conflict with their employer. And when the demand is for a meaningful material gain, it becomes worth their time, their money, and worth their risk to get involved. And I'm not saying this is the only way to win, But in 25 years as a union organiser, hands down, my favourite moments have been taking delegations of care workers to meet with elected local politicians, showing them their impossible rosters, showing them their derisory pay slips, telling them about short staffing, about standards of care, and asking them what they're going to do about it. And then seeing the pride of care workers when they win and the confidence they then take back with them into their workplace union organising. So I'll end by saying I really welcome the paper. I totally agree with each of the recommendations is vital for successful social care organising, but so too is a credible campaign to win a significant material change if we are to build care worker membership, participation and leadership in their unions.
Thank you so much, Kevin, and perfectly to time as well. Wonderful, thank you. Yes, so I'd now like to move straight into to Lydia's contribution. And Lydia is a professor of labour rights at Liverpool University. I'm sure many of you have come across her book, Stories of Care, A Labour of Law. So without further ado, Lydia, would you like to add your reflections, and then we can have more time for questions and discussion?
Thanks, Kate. Thank you so much for having me here, and what a great and timely piece of work. Before I became an academic, I was a union organiser, and I had the absolute pleasure of organising care workers successfully. That was back in 2007. Some things have changed, some things have stayed the same, but many of the recommendations and observations in this report have really made me think back to that time and are so pertinent. But in the current context that we are in, I just wanted to add some context in respect of law, because the problems that are faced by the care workforce, as Kevin has spoken about, they are structural problems, and those structural problems are embedded in our legal frameworks. Amaka has spoken about the vulnerability of migrant care workers, and of course that vulnerability is constructed in law, and immigration policy, migration law has been used in the social care sector in a way where it is acting as a form of labour market regulation in itself, in the vulnerability of those workers. But it's also speaking to a very long-standing problem of lack of rights enforcement, particularly for low-waged and vulnerable workers, the non-realisation of people's rights, and the way in which the regulation of the care sector has not focused sufficiently on terms and conditions of care workers' employment. And yet we stand on the cusp of a very important development through the Employment Rights Bill, which hopefully will soon become an act, the development of what will be an adult social care negotiating body. That is a very, very important achievement of all the work that has gone in so far to organise care workers within the sector. But it also stands as a big challenge to ensure that organising happens alongside that adult social care negotiating body and its construction and operationalisation. And so these recommendations about organising care workers in this report are so incredibly timely. So I just wanted to reflect in three parts, really. My first part of reflection was about the nature of organising low-waged workers in trade unions. So I just wanted to introduce the idea that unions have always found it very difficult to organise vulnerable and low-waged workers. And unions operate within a landscape and a set of conditions which is constructed by the state through law. So if we look right back at the beginning of the 20th century, we had a system actually introduced by Winston Churchill of wages boards, trades boards and wages councils, which enabled some level of representation of workers who were in the most vulnerable kinds of work at that point in time. And those trade boards didn't even have the ability to regulate wages, because in those trades, people didn't have wages. They operated on a piecework basis. They were very insecure. But the government of that day recognized the need to actually provide mechanisms through which there was some form of regulation across these trades and sectors. Then after the First World War, that system developed further so that well-organized trades, well-organized industries sat within joint industrial councils, which is the origins of what we now know as the way in which local authority negotiation with trade unions takes place. But still in these trade boards were those less organized sectors, and they were sectors where predominantly women were employed, things like lace and paper bag making and those kind of industries. But that system existed up until the 1980s, when it was done away with. And from the 1980s, we have seen the UK be in breach of international legal standards around collective bargaining, organising, the freedom of trade unions to be able to operate, the rights of workers to be able to organise in trade unions. This is about compliance of the UK with international workers' human rights that are so important for care workers. In the modern day, we also have human rights that are very relevant for the people to whom care workers provide care and support. So the United Nations Convention on the Rights of People with Disabilities was agreed with the UK government in 2009. And that set of human rights for people with disabilities includes access to support services, enabling people to live independent lives and to have good health. All of those rights within the UN Convention for People with Disabilities depends upon good terms and conditions for care workers, seeing care workers as those people who can enable human rights for people with disabilities. So when we think about professionalisation of the care workforce, care workers play this incredibly important role. So finally, coming on to the significance of the adult social care negotiating body, it is national recognition of the importance of setting up a legal framework for terms and conditions to be negotiated for care workers across England and hopefully Wales, Scotland, Northern Ireland too. And that is an enormous recognition of the significance of this workforce. But what is absolutely critical is that that can be used as a lever for organising care workers, because there is increasingly an avenue becoming visible, an avenue that Amaka has spoken about so well, in terms of being able to be seen as a care worker by people in positions of power. So the more that can be done by trade unions to mobilise and organise care workers, the stronger that route and path becomes. So this report is incredibly timely and important.
Thank you so much, Lydia. Wonderful. Okay, so we've